So I had the opportunity to be the first representative of the Area Health Education Center in San Angelo. I did that position way back in 2005. And some of the challenges back then I think still exist today because Texas hasn't gotten any smaller and we are very spread out community. And so it was very difficult at times to travel back and forth. Just from a self-care perspective, going back and forth between San Angelo and Midland, it helps to have a local contact, an office here versus somebody in Midland. And then the decisions aren't made based on how much is in a travel budget, how much time needs to be spent between San Angelo and the Contra Valley, which is a pretty big area, and then like Midland, Odessa, or Abilene, which are also very large areas, cities of similar size. So because of the great distance between either center, a lot of people don't know the great value that's in an area health education center. I know because I started with them and I talk about them a lot. A lot of people that are connected and work with me know about them, but the community as a whole hasn't really gotten a chance to experience how much potential an AHEC has in its community, and we need that connection locally because you forget who's over in a different city if it's just not your day-to-day interaction. The Contra Valley Rape Crisis Center has some really great youth programming that the Area Health Education Center can support. Just encouraging young people to make a difference in their community. The topic of sexual violence is very much a public health issue, and preventing sexual violence, injury, it decreases ER visits. And then when we work towards preventing sexual violence with our youth development programming, we're preventing violence across the board. So that does have an overall impact on community wellness. Having a relationship with the Area Health Education Center, this has allowed us to expand our youth programming. We've been able to contact more youth in the rural areas, and then just having their support for big conferences and things when we want to bring more youth together. This allows us to just expand the work that we do with young people in terms of keeping our program sustainable through community partnerships. And it shows young people opportunities for health careers and things that they could potentially do in the future. So in going through our programming, they become very passionate about helping others, which makes them a great fit for future health careers. So, and a lot of our students in our programming want to go on and be social workers and be doctors and be nurses and things like that. So, and having a relationship with an Area Health Education Center, we are able to expose them to future roles where they can take what they've learned with us and put that into practice. So those schools, especially rural schools, they are small schools. They don't have a lot of staff, and so they're just doing the best they can with what they have. And they're very grateful for the help, but sometimes it's very limited. Their time is very limited because they have objectives they need to accomplish during the day. So in supporting them as a person who goes into the schools and does work in rural schools, we need to understand how they function. We need to give them, what it is that they need and help them achieve their goals, because oftentimes, especially in rural schools, Coach so-and-so is wearing multiple hats, and so just being a good support for that, to just help them divide up some of their tasks. I think some of the health classes, we've seen a reduction in the number of health classes being offered. The need is still there for students to learn about health and wellness, so an Area Health Education Center, and community partners being able to fulfill those educational needs and still get the students the information that they need is a very powerful impact that we make on those young people. The HOSA, or the health occupation classes, have gotten smaller, and so their ability to just have multiple programs, they're very busy. Youth development is hard work. I've done it for a long time. Youth are very powerful resources, and they need to be treated like resources and not problems, and it really takes a dedicated person to work with youth and understand their unique needs and how to connect them to opportunities, really advocate what's developmentally appropriate and placing them in job skills and matching them to the unique needs of hospitals. So. One of the things about the Contra Valley is when we get on board to do stuff, especially for young people, like, people bring their resources and we make it work. Like, and everybody has a little piece of that puzzle and everybody's very giving and willing to make that work in some capacity. We just need all the players at the table. Just giving more students options to learn about what health careers are available. We have two, good hospitals that had at one point youth opportunities, and some of those have gone away. And I think just having more opportunities for somebody to supervise that and really keep people motivated. With the city of San Angelo specifically, and then the rural areas around us, we're growing so fast. I think in bringing this local, you have a local contact, you have a local face, you have somebody who can be more a part of the community. They can attend coalition meetings, they can get to know the work that's going on here and have a more dedicated scope rather than splitting between other areas that are very large and very far apart and that require early travel and just those difficulties of not being able to connect face to face. We need somebody here who can fully explain what AHEC is, fully explain what AHEC does, fully explain that it's more than just providing a meal. There's services, there's connections, there's support, and then just showing up and being part of the community. That's something San Angelo and the Contra Valley really values. People that get in there, they work hard, they're willing to be a part of that community. So when you have something out of town that's hard to measure sometimes, and it's not that it's not happening, it's just difficult to measure.